Introduction to Biopharmaceutics. Biopharmaceutics is the study of the interrelationship between the physicochemical properties of a drug, the dosage form in which it is given, and the route of administration on the rate and extent of systemic drug absorption. It deals with the impact of formulation on the drug's bioavailability and its therapeutic effectiveness. The primary focus is on how the drug release from the dosage form and its subsequent absorption influence the onset, intensity, and duration of its effect. Key aspects: drug liberation, release, from the dosage form; absorption of the drug across biological membranes; distribution, metabolism, and excretion, basic pharmacokinetics. Biopharmaceutics helps in designing effective dosage forms, enhancing bioavailability of poorly soluble drugs, predicting in vivo performance from in vitro tests, eVivc. It bridges the gap between formulation sciences and clinical pharmacology, playing a critical role in drug development and regulatory approval.